excited when we received the request to have someone speak for this conference. And it seems like a really great conference. So kudos to all of you for attending. I felt even more excited when I was told that the theme of this day was to innovate, impact, and inspire, because I think those words are really big. And for me, nursing has given a lot to my life. And while perhaps maybe a little bit cliche, there's nothing more fulfilling and inspiring than getting to help someone when they need it most. The nursing as a career for me has always had a door open for more opportunity and more innovation. And we're going to get into a few of those things throughout the presentation. Always something more to learn and discover. And there's so much room for growth and experience. I find people often speak and share on the impact that we get to have on them as nurses. But in their time of need, it's always the patients and their families that have had the most impact on me. And it's who I want to be in this profession. I hope you all love this career as much as I have in the last 15 years. And I can't wait to share a bit more about my journey, and hopefully you enjoy. So this is me more recently. I'm a flight nurse with STARS Air Ambulance. And STARS is a wonderful organization, and we all fight the good fight every day with some of the best people that I've met in this role. I'm obviously biased, and I can't wait to share more with you about what I do in critical care medicine, critical care transport, emergency scene response, and a lot of nursing. Like, this role is different from any other nursing role that I've come across. Early in my career, STARS was always the goal for me, and I spent the better part of 12 years working towards that dream. I've been a nurse for almost 16 years now, which some days feels like a lot, but it surprises me how fast it all went by. And as you may already be learning or know, the more you learn and experience, the more you realize how much you don't know and how complex and gray medicine can be. I started my career after finishing my degree in 2009 in Fort McMurray at Keano College. After my third year, I did work as an undergraduate nurse in an Edmonton ICU, but Fort McMurray was my home, and I started working at the emergency department at our local hospital. Working Rural Emerge was a place to really experience all kinds of things for the first time. I realized quickly in my career that the patients who were critically injured or ill were transported out to Edmonton as soon as possible so that they could receive the surgical and medical interventions that they needed. Our resource-limited hospital compared to the Edmonton hospitals, but it didn't ever stop us from showing up and doing the best we could for each patient. People who showed up and were critically ill, our job, of course, was to stabilize them and do the best we could, but the help they needed was in Edmonton, and so we often called very quickly to get the help we needed to send them to where they needed to go. The flight nurses and paramedics and respiratory therapists that I came across were skilled, knowledgeable, and expert in their field. It was really amazing to get to watch them work. I was inspired by these people and the wealth of information that they had and how quickly their brains could work and their hands even faster. This area, working in Fort McMurray Emerge, developed within me a hunger to know as much as possible. I wanted the answers to everything, and every patient mystery I came across sat with me until I figured it out. I clung on to and followed closely the people who were great at teaching, and they helped me to improve my clinical skills that I was taught during nursing school, but also the things I didn't learn in school, things like reading x-rays, reading or learning diagnostic criteria, and understanding which drugs were chosen, which treatments were chosen, and why. When I look back, this feels like a long time ago now, but this hospital gave me something that I maybe wouldn't have had if I had started in the big city. I appreciate the resource limited environments that they are and how hard these people work to compensate for that. I always remember when I'm visiting on a daily basis now, that these people pour their heart and souls into their patients and wake up and do their best. After Fort McMurray, I moved to Edmonton in 2011, and I started working in the emergency department at the Royal Alex Hospital. This is a busy inner city emergency department, and I saw and treated a lot of trauma, substance misuse, infection, sepsis, myocardial infarctions, and heart failure. You name it, we saw it here. This place was a circus, truly. The doors revolved nonstop, in and out all the time, always busy. This place taught me how to manage my priorities. In a job where at any given moment it felt like I had a list of 20 or more things to do, I remember clearly developing a mantra of you can only do one thing at a time, pick the most important. I continued to always ask the questions and seek the answers to learn everything I could. And it became more important and more evident to me to seek out people I trusted that would help me learn and grow. Even some of the best practitioners may not love to teach. My brain remained hungry to understand what I could do better for my patients and their loved ones. I learned here also that unfortunately mistakes and misses were inevitable in our career. I took it hard when I missed something or felt I hadn't done the best job that I could. It would be years before I learned how important it was to be more gentle on myself and my colleagues. And that's something that's really still a work in progress for me. The pediatric intensive care unit. So one day I was at work in the ER, and one of the educators there came to visit me in the trauma rooms after STARS had just dropped off a patient. We were discussing how the paramedics and nurses of STARS were so knowledgeable and talented. These people were taking a helicopter to the scene of a car crash or other disaster, managing a critically injured or ill patient as a team of two, sometimes by themselves for hours, and doing it exceptionally well every time. STARS is an incredibly competitive place to get a job, and it felt like a pipe dream most days. This nurse educator also worked at the time in the PICU at the Stollery Children's Hospital, and she suggested that I look into a job there as they had a critical care transport team, which occasionally got to fly with STARS. She thought that it might be a way to get my foot into the door. That was really all I needed to hear, so off I went. I started working in the Peds ICU at the Stollery, and I had never been a children's nurse before. At the Royal Alex, I hardly saw kids. And in my career up to date, I had seen, could count on one hand the amount of critically ill children I'd seen. I really clearly remember my first day in the PICU. We were taking a tour of the unit, just taking a break from the classroom, and an intubated little girl who couldn't have been more than 6 years old lifted up her hand and waved to me. I was horrified. I thought I had made a huge mistake. This was a completely different world. And what I learned was that the nurses, and truly, I found it a bit hard to break in the first several months. In fact, I tried to quit on more than one occasion, and my manager at the time was wonderful, and she really emphasized that I needed to see it through. Luckily, I did because I love this place, and I still work there. People will often ask me or tell me it must be so hard to work with sick children. And trust me, the bad days can be really, really bad. But what people don't know is that the good days are really, really good. There are way more good days than bad. Kids are super resilient. And best of all, when they feel better, they want to play. In this role, I have the ability to spend days, weeks, and months bonding with families and watching their precious children battle the worst diseases and injuries. Lots of times they make full recoveries and come back to visit. I worked with the most caring pediatric intensivists here who were always willing to help me grow and learn, and had research projects that changed the way we practiced. We always had cutting edge technology around, and the nurses there constantly inspire me still to not only know more medically about things like medications, titrations, interactions, but dialysis and ECMO. Most importantly, I learned how to provide comfort and care to a child and their family. After about a year in the PICU, I started working on the pediatric transport team. If any of you have come across this team, it's super special. It's a team that works to retrieve children for me at the Stollery throughout Northern Alberta, parts of the Northwest Territories, and then we also did ECMO retrieval for Calgary, Saskatoon, and Winnipeg, and we made the odd trip into BC as well. This role was what I was looking for. It came with increased autonomy and taking care of kids outside of the hospital walls on a team of two. We worked as a nurse and a respiratory therapist. In order to do this safely and collaboratively with the PICU physician at the Stollery, We received additional and regular training to maintain our skills and competencies and grow our knowledge. When we weren't transporting kids, we based ourselves in the pediatric ICU and did a lot of the in-hospital transports for these patients. So taking them to CT scan, MRIs, vascular interventions, you can probably think of everything else. We responded also to all of the pediatric emergency medical and cardiac arrest calls in the hospital. I was now not in a position to advocate more for my patients, but also to advocate for the other healthcare professionals caring for these people. On the wards, I took the time on the emergency calls to really understand the concerns that the staff were having and work through it the best that I could with them so that we could all find a place where we were comfortable and knew what the next steps were. Coming from the rural emergency background where I rarely saw sick kids to a place where I was now caring for critically ill kids every day, I recognized that there was gaps in experience and room for growth to improve the care of these kids really across the province. With this team, I was able to seek out more hungry people and get funding to support and start a program where our team members traveled to referral centers to do some one-on-one teaching and sharing. We were able to answer questions that I wish someone would have answered for me back in the early days. Working with kids and their families has been really rewarding for me. And it's such a valuable skill set that because we don't come across sick kids very often, I still pick up shifts in the PICU and the transport team when I can, because it really contributes to what I have to do on STARS. All right, in 2017, I was lucky enough to get a place in the STARS Academy, which we're going to talk more about later. This is the training program for new STARS nurses and paramedics. They are often able to open up space for external participants wanting to grow their critical care knowledge. This wasn't only an excellent learning opportunity, but a place for me to make myself known as a potential future hire, fingers crossed. I was able to sit down with some of the team and ask what it was they needed for me to be considered for a future position. They did recommend that I seek out some adult ICU experience. And again, you didn't have to tell me twice. So I went to the ICU at the University of Alberta. This unit, the brim, that's I had ever experienced in my career. And building on my ER and PICU experience, I was able to translate a lot of what I already knew into being an adult ICU nurse. Although I was taunting and other medications nonstop, balance comfort with their blood pressure, I was also learning complex and competing disease processes in adult bodies every day. In addition to all of these roles, I also sought out as many courses and advanced certifications as I could. Some required by my physicians, some not. Some I had to take regularly. I've always been passionate about providing the best care to my patients. Might be corny, but as we know, knowledge is truly power, and there's always something for us to learn. I still find it kind of funny when I've taken some of these courses 5 or 6 times, and I still learn something new. Okay, this is probably what everyone actually wants to know more about, but after 12 years, several critical care jobs, and lots of extra training, I finally made the dream come true and was offered a job as a flight nurse for STARS. The job itself is better than I imagined it would be, but also more importantly, has been way, way harder. I could talk to you all day really about how wonderful the job is and all the things that I get to see and do. But what's important is how the organization comes together to provide safe critical care transport and all the things that we all do to improve patient care and save lives. Instead of talking to you for hours and hours, because the time limit's a little bit strict, the marketing and communications team at STARS is constantly developing videos. So I'd hope to show you guys a video a little bit more about how our version of helicopter EMS works. And then please somebody stop me or feel free to speak if this doesn't work or the volume doesn't work.
We've all seen the red helicopter before, but do we know everything it represents? Our signature Red Stars helicopter brings the highest level of care available to the sickest and most injured patients in our community. The sooner these patients receive treatment, the better their chances of recovery. We have 6 bases across Western Canada and typically fly within a 300-kilometer range of our bases, but refueling stations allow us to extend our reach. Patients are flown by helicopter to save time. Transmissions and hospital transfers. Or incidents at Hartman's Field. In these cases, a helicopter can fly directly to the accident. To smaller rural hospitals don't have the right extremely sick patients. In these cases, it makes sense to move these critical patients to a hospital in a bigger city. Provide an extremely high level of care from the moment we arrive at the patient's side to when the call is complete. STARS helicopters have advanced equipment on board, just like you find in a major hospital ICU. Ventilators, ultrasound, and monitors, and can perform blood work analysis, blood transfusion, so much more. Successfully executed. STARS helicopters with years of critical care experience. New Air medical crew members undergo a 20-week training program that exceeds 500 hours of instruction. After that, they complete 125 hours of training every year to keep their skills razor sharp. Staff are supported by the STARS Emergency Link Center, which uses advanced mapping technology to make sure our missions are safe. Who are available 24/7. Patients call VIPs for very important recently flown. Tens of thousands of missions since 1985. That's about 8 missions every day. We believe every life is worth fighting for. Care should be available for summer trips. Though the funding mix in each province is different, it's the same. We don't make money from billing patients, and only a portion of our support comes from the government. So the donations we receive from the community will make our missions possible. A mission is more than just a flight. It's about the training. The next time you see our red helicopter in the sky, together we are all stars.
All right, hopefully you guys enjoyed that. It's just does a better job of explaining everything than I think I might. I wanted to touch a bit about STARS Academy. So this is the course that I had taken as an external participant, but in January 2021, when I went back to, when I got my job with STARS, I went back to the Academy. In just 4 years since I last took the course, the education being delivered had changed. It was more current to keep up with the best evidence-based research. So the program is 20 weeks. It's a mix of online learning, in-person lectures and discussions with experts, and tons of simulation and skill practice. So much simulation that you just don't even get nervous doing a sim anymore. We also mix that in with several months of flying as the third member of the team so that you can really learn your new role, see how others do it, and learn to work with a new partner. Constantly, I was in awe of the educators and the other crew members. These are some of the smartest people I had come across in these professions, but they were the most humble in their delivery. What was most inspiring to me during Academy wasn't the wealth of knowledge or all of the new skills, but it was that these educators were always open to new ideas or ways of doing things. They would come to us and continue to seek feedback from all levels. They would take that feedback and immediately make change so that we could learn better. These people are masters of growth, and they're always wanting to be better. So at this time, I wasn't only learning better medicine, but I was learning how to be a better person, nurse, and educator. All right, flight crew. So every day when I show up to work, our flight crew consists of 2 pilots and 2 air medical crew. The pilots who sit in the front, obviously, are incredibly experienced, and many of them have military background. They may seem like the guys who are up front, and trust me, when we do a public event, everybody wants to talk to the pilots, not the medical crew. But all four of us work very closely together to get each job done safely. These people have become my family. We see all kinds of terrible things regularly, and we do all kinds of things together to help these people. This leads to a strong bond between us. I'll speak specifically to the Edmonton base because that's where I work now, but we have 10 nurses, 10 paramedics, and about 20 pilots. Our daily routine consists of 12-hour shifts. So at Edmonton base, we do 7 to 7. Throughout that shift, we're not allowed to leave the premises. So I can't go out and grab lunch or coffee because we're always on call, and we aim to be in the air within 12 minutes from the time of dispatch. We also can't plan to be off on time at the end of our shift, as there's a pretty good chance if you make plans, you're going to get a late mission that doesn't end until well after 7. We show up and work out of a building that's at the Edmonton International Airport. We arrive, take over from the previous crew, and then the four of us meet in the operational room to have a safety brief. In the safety brief, we discuss weather, daily logistics, and if there's anything new or of note that needs to happen for the day. Sometimes the weather isn't suitable for helicopter flight, so we can also dispatch the medical team in a ground ambulance whenever needed. Each shift, we start and have daily checks and tasks to make sure the helicopter, all of our gear is ready to go. We each carry a radio that our dispatch center or emergency link center uses to alert us to the scene of a hospital or a call or a scene call. The pilots will check the weather, and we do that separately because we don't want whatever medical information comes through to bias their decision on whether or not it's safe to go. For a scene call, the link center then calls us to relay their information, and they give us details about the patient and their illness or injuries, and they get these details from 911. They can also tell us about which EMS crew is closest, who's attending, whether it's an ALS crew or a BLS crew, and how far away they are. Based on this information, my partner and I then decide if we should dispatch right away or if we're better off to wait for the initial EMS assessment on scene. For a hospital call, it's a little bit different. We're placed in a teleconference with the referral doctor and our transport physician. They discuss the patient and then determine the best method of transport. So that could be ground to ambulance, fixed wing plane, or helicopter. At the Edmonton base, we average about 3 calls or missions in 24 hours. So this means that some days we don't fly at all. Not very often does that happen. Some days we fly 1 or 2, and some days we fly 3 or 4. During any downtime, many of us do office work. So in addition to our flying shifts, we have a role that we do to support the organization. We train regularly in our sim rooms or do learning on the computer, and we often participate in events and tours around the base, and I'm going to show you some more of that later. So this, if you guys can see my little pointer here, this picture, this is our where we do our safety briefing, and you can see the TV kind of shows us all the weather. I feel like the pilots must go to like an actual weather school because they know all kinds of things that I just haven't been able to take on yet in my brain. This is the back of our helicopters, and across all 6 bases, the helicopters are all the same. So they're interchangeable for us. You can see, and here is our IV pumps. This is our ventilator, our cardiac monitor. And that's probably the most of what we can see in this picture. Up here is our link center. So that's where we dispatch from, and they're located in Calgary. And then, of course, outside of our building. Roughly half of our calls are scene calls. They can be anything and anywhere. So sometimes we're dispatched to a patient only because their location is so remote that a ground ambulance is unable to access in a timely manner. Sometimes it's because these patients are so injured that they need our critical care expertise, or we're the fastest and they need to get to tertiary care as fast as possible. Other times we may be dispatched because there are too many patients for the resources in that area. We can either dispatch ourselves to a scene call, as I mentioned, or be dispatched by EMS on the ground. We can also be auto-dispatched based on a list of predetermined criteria that's pushed through from 911. An interfacility transport occurs when a patient presents to a rural center and is too sick to remain there, or needs a higher level of care. We respond to some hospitals several times a week, and we get really good at working with them to stabilize patients and transfer them to the other hospitals that might have what they need, such as an ICU, cardiac intervention, neurological intervention, or any kind of other specialty surgeon. In the back of the helicopter is the air medical crew. So this is always one paramedic and one nurse. Often in the third seat in the back, we'll have a ride along. So that could be a learner or just an observer. So sometimes residents, sometimes nurses, sometimes paramedics. Although my partner and I have different backgrounds, our previous experience complements each other really well. So their experience helps us function logistically going to a scene call, whereas I have more experience in ICU transfers. However, when we start Academy, we receive the exact same training, and that makes our roles interchangeable. So I can do what they do, and they can do what I do. But we often divide and conquer when it gets busy. In addition to the two of us, we always have a physician that's on call. Typically, these doctors have emergency, anesthesia, or ICU background, and sometimes they have a mixture of more than one of those specialties. We work really closely with these people. We train together and develop strong, trusting relationships in which we help each other out when needed. Most often, the doctor doesn't come flying with us, but occasionally when they need to perform a procedure that we aren't trained to do, such as a pacemaker insertion or bronchoscopy, they might jump in. At STARS as a nurse, so remember my partner and I have the same scope of practice, but this is quite expanded from what I'm used to in the hospital. So all of the things you see here, like intubation, surgical airways, those are all things that I've been trained to do at STARS and I'm responsible to be competent at. Some of the best advice I received early in my training here was that even though my partner and I are all alone in the back of a helicopter, we always have resources available to us. So we have our radio and phone, and we can speak to our transport physician or really any doctor or surgeon if we needed to really help us understand how we can help care for the patient the best. We also have the ability to do video conference to get better advice and understanding. And so as you can imagine, explaining something over the phone doesn't quite always do someone justice. But when I can dial it or click on a link and show the physicians what I'm looking at, sometimes you don't even need words. And so sometimes we'll even do that in the helicopter where they can't hear us, but they can see what we're dealing with. So our practice at STARS is dictated by a really large and robust set of critical care protocols. These protocols are available to everyone as a free app, and the app is called AHS EMS. I refer to the protocols obviously now all of the time, but even before I worked at STARS, I would use them as a reference because there's so much information in there. So when I was dealing with an overdose in the pediatric ICU, I might pull up one of those protocols from the STARS AHS EMS app. We use the protocols as our roadmap, and we memorize most of them when we're doing STARS Academy. They provide us with an incredible amount of autonomy. But what I maybe didn't realize when I was so desperate for more autonomy was that they also give us a great deal of responsibility. I remember when I had just first come off training, I was dealing with something and giving a lot of huge medications. And I thought to myself, do I really know what I'm doing? Like, am I capable of this? The critical care protocols that we follow are largely developed by people at STARS. And that's in partnership with people at Alberta Health Services. When I'm not flying, this is my office job. You'll find me working as a CCMCP support person. Our team constantly is reviewing, editing, and building protocols that keep practitioners in line with the most current and best evidence-based research in transport care. You can see in these, so I picked this protocol because it's just, they try to be simple. We lay them out. You maybe have some answers to answer some questions, and then it directs you through what you should do. And at any point, if something is, conflicting or not what you're wanting, or you're not 100% sure, you still have the opportunity to call the doctor and discuss with them. So although we're trained to be interchangeable, and more importantly, we back each other up all the time, my partner and I generally tend to stick to our own roles, especially when it's really sick people or complex cases with high cognitive load. The paramedics are often responsible for the airway and breathing, so they intubate the patient and then generally manage the ventilator. These are the nurse roles. And so this is generally what I'm responsible for on each call. But what's important to remember is we're always interchangeable and we're constantly bouncing things off of each other. Often in a super sick patient, we only have 10 seconds or less to share information. So what we have to do more importantly than these skills is be really good at communicating and master the softer skills of nursing and medicine. We often have competing priorities. And so maybe they want to do a really good job oxygenating and ventilating with the ventilator, and I want to do a really good job with the blood pressure. And those two don't always go together. So sometimes we have to sacrifice one in order to achieve what's best for the patient. So with all of that said, of course, we have to continue to do a ton of education to show that not only we maintain our competency to people who audit us, but to maintain our skills and knowledge for the patients who need us. Monthly, we're responsible for doing an online module, and we may review things like COPD, asthma, or hemorrhagic shock. And we also work on shift within that month to complete a monthly checklist and a skill set. So sometimes that's IO insertion, arterial lines, or review ventilation protocols. Quarterly, these are all my friends. We're doing sim. We do sim a lot. Quarterly, we have to do a simulation, and they kind of rotate through all the bases. So we might have obstetrics, trauma, neonatal resuscitation, pediatrics, medical, cardiac, difficult airways, all kinds of crazy things. At some point in the quarter, we have to intubate an infant, a pediatric, and adult. That can either be sim or reality. And we have to perform all of these skills and check them off with a partner. At STARS, we closely track a lot of the skills that we're trained to do, such as intubations or arterial punctures, and they track their success and failure rates. And that's not to blame anyone or make us feel bad. It's actually a completely different mindset where we track these things so that we can all learn from the mistakes and failures and do better. And on a yearly basis, or every 2 years for some, we're responsible for maintaining these courses. So STARS provides us with a yearly airway, ventilation, and pediatric day. And in those days, we review current literature, things we've been doing, things we could do better. And like I said, learning from our mistakes often. We have expert lecturers and review the latest cases that maybe didn't go as well as they should. And sometimes we even simulate those. At STARS, there's always room for more growth. That's the thing that I really love the most. There's constant innovation happening, and there's always leaders around. I'm surrounded by people always who want to do better, even when at baseline they're doing excellent. So at each base, there's a clinical educator who's responsible for the maintenance of skills and competency of their AMC. They play a big role in also delivering the regular education for the entire organization. The central education team is the people I talked about who do Academy. They are also largely involved in bringing in new initiatives. So, there was a time at STARS when we didn't use ultrasound or ventilation, and they're responsible for making sure we're all really good at that. At each base, we have outreach educators who are largely responsible for organizing education and delivering educational programs to practitioners who are outside of our organization. So at the request of hospitals and healthcare sites, we travel to deliver a full day of critical care learning and partnership building to improve the healthcare of people all across the country, really. STARS has a research team that is constantly working on something amazing. I smile because they really are. Whether it's a trial for finger thoracostomies or tracking our blood product administration, carrying more blood products, they're always trying to better patient outcomes, not only within STARS, but everywhere. This is what keeps our organization motivated and cutting edge, and all of us are really excited for these initiatives. We have many people who work on quality assurance at STARS. So that's the stuff I was talking about, where we track the stats, the failures, and we talk about how we can do things better. There's also always someone reviewing your chart. So there's a medical review that comes from our base medical director, but there's also a peer review. And then, of course, we have a management and executive team who's actually frequently on the front line. And so they work with me as my partners. And then they also travel throughout the bases and internationally to make sure we're keeping the organization at top standard. This is more fun and something that I really enjoy doing at STARS. So in addition to all of those roles I just talked about, We also like to do an annual simulation competition. So STARS holds a competition at each of the 6 bases. The winner from each base then travels to a national within STARS. For these competitions, there is no stone left unturned, making this simulation as crazy and real as it can. Recently, they've included a remote multi-casualty boating accident where the participants who were actually flown to a real riverbank. There's been a rave party that was very dark and loud, with dozens of attendees found unresponsive, requiring rapid triage and treatment. And the one that I went to most recently was a hockey game in Regina. There was a volunteer drama company in the stands, ringing cowbells and waving signs. And the players of each team were our executive leadership. So there are all my bosses watching me simulate medical treatment. Even better, it broke out into a bench brawl, and there were several life-threatening injuries that my partner and I needed to manage. The winner of the overall STARS competition trains incredibly hard and then gets to represent us at an international competition in the United States. We've been going for many years, and we've frequently placed at the top. We have never finished below the top 3, and this year, these 2 just obtained the top of the podium again with a first place finish. So this is one of the patients that was in the, he was hit from behind and unresponsive with a head and a spinal cord injury, and he was in shock from those. This looks like there's, I think they were doing a car crash with multi-casualties and someone who was delivering a baby imminently. And then these are some of the other ones that, this is us as well in the Regina hockey game. Okay, perfect. So I have one more video to show you, if for nothing else, then to leave a little bit of an impact. So my job is super cool. I'm really lucky to have it. And taking off in a helicopter and landing on a huge building in the middle of the city is super wild. But aside from that, the reason all of us at STARS do it is so that we can help our patients. As the video first said, the first video I showed you, these patients, we call them very important patients. And they often come and visit us, take tours of the hangar, and then help us develop videos like the one I'm about to show you. I just wanted to end with today so that you can have a reminder, same as I do, as to why we all do what we do.
Hi, Brittany. We can't hear the videos.
Can't hear them at all? I thought someone said it was better last time.
No, they sound like robots.
Oh no. Okay, I'll play it from a different source. Maybe that'll help. Give me 1 sec. What about this one?
When I went to work, I had no idea.
It's a little better.
The accident, setting in, since there was a storm coming in, so you've got to push to get the job done. You sort of just start the day like we normally do, shots going, and then some office work, go downstairs, do my workout, come upstairs, and then the phone started going. I mean, it's a purpose for a high mechanism, so versus a setting. We didn't really have a lot of information. So, in between the truck and the excavator, 18 tons of truck and 20 tons of excavator. It's an elevator in my life.
I'm just going to pause for a second. It says that somebody commented that there was it sounds like it's coming from my speakers, and forgive me, I haven't shared a lot on Zoom. We use a different program. Does anyone know if there's a better way to do that? This one.
How about I get the link and I can try play it?
Sure. That would be helpful. Thank you. Sorry, guys. Can I just Did you get that link okay?
Yeah.
Okay, perfect. Thanks. And do you want me to stop sharing mine?
Yeah, I can try that, yeah. And I'll share my screen.
Okay, awesome. I'm making out.
I think your screen is still being shared.
Okay. It says multiple can share at the same time, but let me just.
Yeah, I can still do that.
I stop that. I don't know if it's like I feel really silly, but I don't know if I see a button that says to stop sharing. Oh, there we are. Winner. There you go.
Okay, you guys see my screen now?
We do have EMS responding stairs and dispatched as well to your area.
That morning when I went to work, I had no idea I was gonna need stars that day.
Mission accepted Start has accepted for weather. They have been dispatched.
The day of the accident, it was cool, fall setting in, and time is of the essence. There was a storm coming in, so you've got to push to get the job done.
We sort of just started the day like we normally do. Sean is gone. I've done some office work, go downstairs to do my workout, come upstairs, and then the phone started ringing.
The initial call was for a high mechanism, it was a loader versus a semi. We didn't really have a lot of information other than somebody was trapped.
I was pinned between the truck and the excavator. 18 tons of truck and 20 tons of excavator. I was broke within probably a millimeter of my life.
I was told that there's been an accident, and the ambulance is there, and they couldn't tell me what was going on, and I just remember saying, well, is Sean okay?
The day in question, it was just a little bit lower weather than we like to see. Nothing we wouldn't be able to fly in, but definitely a day that, you know, fundamentally as pilots, we like to say you want to stay close to home if you can.
Flying a helicopter in icing conditions is a very dangerous situation. We want to avoid that at all costs.
When the dispatch came in for the Grandview Hospital, that's a 156-mile trip, and that's a fair distance to have to cover in weather like that.
It wasn't just a straightforward fly to the patient and fly home. It was going to be tough both on the aviation side and the medical side.
So when we pulled into the hospital, we were driving past a lot of the workers that we know. Nobody would look. Nobody would make eye contact with me, and I think that's when I knew that this wasn't something minor.
They rushed me to Grandview. Thankfully, there were 3 doctors there that morning, and they were able to keep me alive till stars got there.
I remember the helicopter coming in, and I remember looking at it thinking, this is our answer. This is what's gonna hold our family together. If they can get him there, then I think we'll be okay.
When we got to Sean's bedside, his vital signs were critical. He had 2 collapsed lungs, and it was affecting his heart. I thought his chance of survival to Hill Sciences Center was about 10%.
I honestly didn't think we were going to leave the room. I didn't think the patient would survive for us to even put him in the helicopter.
One of the waiting rooms in the hospital faces a field, and that's the field that we share with our K-12. And I could see our 2 boys playing basketball, and I just thought they have no idea. I couldn't process the fact that I'm watching my kids enjoy what could be the last moment of their childhood that they know. I remember that helicopter lifting off and thinking that is the most precious cargo that they will ever have.
So on the way back to Winnipeg, he got, I believe he got a total of 6 units of blood.
My hands were constantly moving. We were constantly trying to manage both his blood pressure and his oxygen levels with our ventilator, along with blood and many other medications to help keep his blood pressure up, at the same time trying to keep him comfortable.
At one point, Daryl chimed in the back and he said, we might have to land in Portage. We might not be able to get to Winnipeg and we'll have to arrange a ground ambulance. I just impolitely said that this patient would not survive if we had to stop in Portage. And then the weather cleared and we had the opportunity to get all the way to Winnipeg, which was amazing.
We fought to get to him. The bystanders fought to get him to the hospital, Grandview Hospital, and all their staff, fought to keep him alive. We fought to keep him alive all the way back to Health Sciences Center.
I had a lot to fight for, and I just thank STARS give me the opportunity to fight for it.
There's not really words in the English language that can portray how thankful and how appreciative not only myself, but my children, our entire family, how vital their role was that day to just keeping our lives together. It had the chance to explode our little bubble, everything we've ever known.
A mission like this is the reason why I joined STARS.
You only have to meet one family. You only have to see one patient on scene struggling for their lives to really realize just how important the work is that we do and how vital it is to everybody around us.
You never know what the day is going to bring or what might happen. You have no idea. So donating to STARS is essentially donating time. You are giving somebody time to get to the hospital. There's all sorts of things that money can buy, but money can't buy time.
You guys have, you give me my family back. You don't realize how fragile life is until you have a scare like this. You take every day for granted that you get up, you put in a full day and do everything that you can, and that you'll be coming home. And I had no idea that day would change my life forever. And you guys have brought me back from
missing everything.
From everything being gone, yeah.
Thank you for sharing that. All right. Oops, let's not play it again, like terrible. All right, and that's really all I have to show you guys today. And I'm happy to take any questions in the chat or, verbally is fine too.
Hi, I actually have a question.
Yeah.
It's funny because we actually had Debbie come in and talk to our class on Thursday, at U of A, and she was telling us about like the requirements and whatnot to get into STARS. And with some of the centers, I know in Edmonton, sometimes it can take upwards to 10 years, which can be very daunting for a new grad. So I asked her kind of the same question, but I'm going to pose it to you too, because it's good to get that information from other people. What are some things that we can do as a new grad to like kind of get our CV going? And I know one of the other presenters talked about building your brand, so to speak. So is there anything that you recommend that we could do?
Yeah, I would encourage you to consider that with every position that's posted with STARS, there's hundreds of nursing applicants. And so within that hundreds, you have to assume that there's, dozens of people who are capable and have the resume. what I need people to remember, and something that often, is the reason why people don't get interviewed, is every single day is a job interview. It's not about the skill that you have, but when we're only accepting one nurse every 5 years, it's about your personality, how you treat your patients, what you do for them, how you go above and beyond in your everyday, and how you treat your peers. Because in our job, we often experience things that, like I talk about going to resource limited centers, are not maybe necessarily the way that we do things. But it's important to remember that people are always doing their best. Everybody wakes up with the intentions of doing good that day. So building your brand in this scenario isn't necessarily about the experience you gain, but it's how you act in every day. In addition to that, I can see there's another question now. There's people who are going to tell you yes, and in some places it is for sure going to be enough, and that might even be Edmonton at a point. In my opinion, most of what I do every day is ICU care. And so without the ICU experience I had for years, I don't think I would be as good at that as I am now. Does that answer your question?
Yes, it does. Thank you. I was hoping to do like the emergency route, but yeah.
I see there's another
I
question.
see someone. How many years of experience did you have, or how long did it take you to get into STARS? So I got into STARS at 12 years, 12 or 13. And that is probably pretty average for the Edmonton base, where, like I said, we're really only hiring maybe one nurse every 5 years. People really don't leave this job once you get it. It's a really wonderful job. And so you kind of ride it out. And a lot of our nurses have been doing it for 20 plus years. Any other questions? Yeah, so we do take ride-alongs. I see someone asked about a shadow or visit the base. We generally will take ride-alongs for people who are interested in that being a career for them, or who are just interested in knowing more about transport medicine, especially if it's something we come across, or a place we come across really quite frequently. Online, you can log onto the STARS website, and there'll be an email contact for whichever base is most local to you, and you can send an email looking asking for a ride along. We're only really offering usually one a year, and sometimes it's really dependent on what your interest is. And so I would encourage in the email that you send to explain why it is you want the ride along, and kind of do a good job of that. Anyone else? Are there physical requirements to pass prior to the job? Not really. Nothing that's official, but I would say, it's definitely taken into consideration that we're climbing in and out of a helicopter all day. We're spending 6 hours cramped in the back of a helicopter. We have to hike sometimes into the bush to find a patient, and not in Edmonton, but sometimes, mountainside. And so it's definitely easier to be higher in fitness. And I think, most of the people I work with try to prioritize that.
That's perfect. Does anyone else have questions for Brittany?
That's the furthest you've had to fly to reach a patient. So I'm a little bit different. I spent the first year of my STARS career working in Winnipeg, and they also have a fixed wing service that STARS does there, and so that's quite a bit different. And some of those flights were a couple hours each way, going far north up near Churchill. In the helicopter, on average, we go 300 kilometers, but from Edmonton, we do make our way up to Fort McMurray, which is close to 450-ish kilometers from time to time. So I know there's also missions in STARS that, were close to 10 hours, 12 hours long. Yeah, feel free to send me an email. Let me just put my email in the box here, and any of you can feel free to email me. I get it. I was like totally hungry for STARS from the beginning, so I'm always happy to answer anything. ICU and ER experience is vital, but what about other flight nursing experience? That definitely helps. I know because I flew for 10 years with PEDS Transport before I started with STARS. And so that was valuable. But they're of course going to look at what kind of flight experience it is that you're doing, because critical care flight isn't necessarily everywhere. And so that's super helpful. Well, thanks you guys very much for having me, and thanks for all your questions.
Thank you so much for coming. It was a very good experience. Like I'm pretty sure like a lot of people were very interested in looking after stars. It's not something that you came across every single time, right? I personally like
thank you.
Come attend this one, and it really felt good. Thank you so much.
Oh, good. I'm so glad you enjoyed it. Thank you guys so much for your time.
Okay, guys, before we go, as mentioned, like there's another gift card that we have. Shusti is here, so we both will give that out. So this one is a $250 worth UWorld 90-day subscription. A lucky winner would have access to it. So I have the wagon wheel ready, and I'm just gonna share the screen here real quick. So all the people like who really engaged, they have double entries. I'm gonna share the screen real quick. Are you able to see the screen? See the screen?
Yes, we can see the screen.
Okay, let's see. Kevin, are you here? Perfect. Congratulations, Kevin. So this one is a UWorld 90-day subscription, and leave us your email for us in the chat, and we'll reach out to you ASAP. Thank you.
Everyone can start heading to the main room. We should be wrapping up in about 10 minutes. We'll just be providing some information about the upcoming national conference that's happening in January, and also announcing the winners for the National Nursing Students Week awards, and also doing a final prize draw. So it shouldn't be 10 to 15 minutes.